exercise we're going to look at in this short video is a bent knee fall out. We're going to look at two levels of this exercise, and I would advise you start with the first one to bring a little bit of awareness into your body and understanding the mechanics of how you move and what suits you, and then you can progress to the next exercise, which really helps you to understand how when you increase demand or load into your movements, how the body should automatically respond to that. So you should feel a little bit more effort through your torso, through your lower abdomen, to help support these movements that we will work from the hip. So come to lay down. As always, you can be on a yoga mat, you can be just on a rug or anything that you feel supported on. If you're on a, say, mattress in your bed, you're probably not going to have as much support as you need, although you still can work these exercises from a mobility point of view. If you are feeling or experiencing any pain during these exercises, it's really important that you stop, and also just to make sure you contact one of the team or your healthcare provider. So let's start in our rest position. So feet flat to the floor and knees bent. I always have to have a little shuffle on the mat to make sure that I feel that I am quite lengthened into the spine, that I'm not sort of scrunched over to one side or the other, that I do feel almost as though you could draw a ruler line from the top of my head all the way down through to between my toes. Feet are parallel, so I'm trying to point my toes down to the bottom of the mat and trying to keep my heels in line with my pelvis. So if I look over to the right and the left, I can just about see my heels as I curve my body around. So we'll settle down. Bring your hands onto your pelvis. Always really good to give yourself some feedback of where the pelvis is. And to start with, I just want you to roll the pelvis from side to side. So you'll tip over towards the left and over towards the right. So I'm hoping you can start to feel that you land all your weight into one side of your body, and then you roll all the way over into the other. And the reason I want you to understand what this is, so you understand that when we do this in the movement, we want to try and avoid doing this in the movement. We want to keep the pelvis steady. So roll to the left and roll to the right, and this can be quite a nice, gentle movement for the lower back even before you start. And then settle yourself quite straight. So I want you to feel almost as though left and right there's equal balance. If that was a scale, you'd have equal weight either side. Then come into your breath work. So you take a breath in, you expand into ribs, maybe a lift into the belly. On your exhale, see if you can find that connection to lower abdomen where you start to create a bit of tone and a lift into your pelvic floor. You breathe in and out. And just a gentle reminder that this isn't a strong grasping through into those muscles. You're not clenching. You do want the activity to be quite subtle. And we breathe out. Next time you breathe in, you prepare. And as you let the breath go, as you breathe out and you can puff it out through your mouth, you let your right knee roll out towards the right side. So I'm keeping my foot on the floor, but I'm rolling to the outside edge of my foot. Fingertips are still on my hip bones, and so I'm watching, am I rolling into my right hip? And I'm trying not to. So what I'll imagine I'm doing, just going to pull a little bit more weight through the left hip, and if you do that, you'll notice you get a really lot more activity through your lower abdomen. And then bring your right knee back up through centre, so the knee points up to the ceiling. Take another breath in. As you breathe out, let the left knee roll out towards the side. So the same thing here, and do breathe in between. I'm not expecting you to hold your breath for each time. The left knee comes out to the side. Watch whether that weight of your leg is letting yourself tip, so you have a space under the right side of the hip. Pull down into that right side. It's almost as if you had headlamps on your hip bones. They're staying pointing up towards the ceiling. And then lifting the left leg up. You roll, right knee out towards the side. Again, those headlamps on your hip bones are pointing up. Imagine you've got a spirit level across there holding tight, and lift. Left knee out towards the side. And lift up. Roll the right knee out. So I'm just rolling on the outside edge of my foot and then planting the sole of the foot flat towards the floor and the knee up towards the ceiling. Then the left knee rolls out to the side and comes all the way back up. So you're moving one side to the other, right and then left, and holding the pelvis steady. So we try not to move, not to let any tipping or rolling in the pelvis at all. And it is quite a good way to practice this movement if you let the knee kind of just hang out towards the side, and notice if you do rock and then actively pull down into the other side. So my right knee's out towards the side and I'm trying to squish down and the back of my left work, and I instantly feel that work through the lower abdominals to hold me. Then bring your right knee up through centre, left knee out towards the side, and then up. And through that last period, you notice I haven't cued your breath, because sometimes it can be really complicated to work with the breath. I will work more as we move through, sort of progress into classes with those. But the main thing is I want you to know that the breath connects to muscle activity, and that if you breathe nice and smoothly, so you're concentrating on a lovely fluid breath as you do the movement, so you're not holding, you know, grasping in as you perform the movements, you do move, and working on stability in the pelvis is really what we're aiming for. And you should find that you connect to your core muscles as you do that, or lower abdominals. So really what we're looking at here, there's a muscle called the transversus, or TVA for short, which is really deep into the abdomen. So just still letting the legs roll out towards the side. Now you might want a little break there and have a pause. You can have a little sway of your knees side to side, finding a bit of rotation in your lower back. And we're going to progress this onto the next stage. And hopefully this will help you to really understand, again, how the body responds to demand. So we start in the same position that we were in, lengthening through the back of the neck. We've got the natural curves of our spine, so we're not flattening the spine down, we're not squishing navel to spine. We're letting there be a little space underneath the back of the waist. And you do want space. You can see I'm holding my thumbs on my rib cage and fingertips with my hip bones. We want this space here to stay quite equal, almost as though the front of the body and the back body has a nice sort of length and spaciousness. Come back to your breath again. Think about, can you connect to that gathering and drawing as though you're wearing a low corset to hug and hold in through the abdominal muscles. So you breathe in, there's expansiveness. And as you breathe out, you can find that gathering and drawing through lower abdomen. Lift into the pelvic floor. Sometimes when we pull in the abdomen, we can bear down, and we definitely don't want to do that. So just a couple of breaths again, finding on that exhale, gathering, drawing, holding, so we can support the pelvis. We will work with the breath a little bit more here, so I'll work quite slowly. If your breath doesn't time in with mine, do work with your own breath. Don't become dysfunctional by following me. So always start with an inhale to prepare. And as you breathe out, it's our drawing and gathering through the abdomen, and we lift the right knee over the right hip. Okay, we take a breath in to hold, and on our breath out, we're going to let that knee come out towards the side. So you can see I'm just lowering the shin down towards the ground. Now I'm already feeling I'm tipping into my right hip. So I'm going to pull down into that left side, and there's so much demand through the lower abdomen to hold me there. And then I'm lifting the leg up, and an exhale to lower the foot down. Let's do that again. We'll work on the right side again. So we'll work maybe 5 on one side and 5 on the other. So take a breath in, you exhale, control through the abdomen, and lift your right leg. Another breath in to hold. This time your exhale is opening the knee out towards the side, making sure you're keeping level through the pelvis. If your hands are on your hip bones, that's going to really help you get an idea of that. Lift the knee up through centre, you breathe in and out to lower the foot. Breathe in to start. Breathing out, holding through the abdomen and floating. Right knee over right hip. Breathe in to hold. And breathe out, the knee opens out towards the side. Pull down into the left side of your pelvis if you can. Breathing in, lift the knee. Breathing out, lowering the foot down. Breath in to start. Breath out, gathering, finding your connection to the core, lifting the knee. Breath in to hold, and a breath out to open the knee out towards the side. Breathe in to lift. Breathe out to lower the foot down. Breathe in to start. This is our last one on the right side. Breathing out, connection, leg floats up. Breathe in to hold. Breathing out, open the knee out towards the side. Inhale to lift the knee. Exhale to lower the foot. And then you can take a big breath into your ribs. Exhale. Sigh out. You might even lengthen your legs, give them a shake before we set up for the other side. So when you're ready, feet walk in. We'll aim for 5 on this side. So again, realign yourself. Make sure you feel the natural curves of your spine. So we always talk about the S shape through our back. We want shoulders to connect. Space underneath the back of the waist, very small space, back of pelvis lands heavy. Fingertips onto hip bones, just to bring our attention into whether we're rocking to the left or the right. Take a breath in and breathe out. So a couple of breaths just to really set yourself up well. A breath in and out. Can you feel the lift into pelvic floor? Because again, we don't want to get caught up in downward bearing at any point. And this time we'll start to move. So you breathe in, begin, exhale, floating the left knee over the left hip. Breathe in to hold, and breathe out, knee out towards the side. You might find one side is much easier to control than the other. Lift the knee on an inhale and lower on an exhale. So as you breathe out, take a breath in to start, and breathe out, knee over hip. Breathe in, hold, breathe out, knee opens out towards the side. So just watching, can you pull equal weight into the right side of the left side of your pelvis? Breathe in, lift the knee up through center. Breathe out, lower the foot down. Breath in to start. Breath out to lift. Breath in to hold. And breath out towards the left side. And lifting up as you breathe in and out as you lower. Breathe in to start. Breathe out, floating left knee over left hip, shin parallel with the ground. And remember, we're not flattening the spine down. Breathe in and out to fold the knee out towards the left, watching you're not tipping or turning in the pelvis. Inhale to lift the knee up. Exhale to land the foot down. We'll just do one more on that side. Breath in to start. Breath out, lifting. Connect to your lower abdomen. Really feel that support. Take a breath in. And as you breathe out, pay attention. Can you feel that work? There's more load as the knee comes out to the side. So we're dialing this intensity up. You should be working hard through your abdomen. Lifting the knee on an inhale and lowering the foot on an exhale. And again, you can have a little sway of your knees side to side to release, or lengthen your legs out and give them a little shake. Now, one really important thing to watch as you do this, and I always say, imagine you're having a cup of water on the opposite knee as you perform these exercises. So sometimes as you lift your knee, you're okay here, everything's well aligned. As you start to let your knee come out to the side, so I've got right knee coming out to the side, sometimes your left knee can open to counterbalance. We want to try and avoid that. Almost imagining you have got a cup of water on the left knee and you've got to try and hold it steady, and that means pulling down in the left side of the pelvis rather than letting the knee fold out to help you to support yourself. Knee up through centre and knee down. So just a little watch point for you as you do those exercises, but give them a go. If you have any problems or need a little bit more advice on those, you can always contact one of the team. And if you've got this video, the chances are we've already gone through some of these exercises with you, but we're always here to offer support and advice should you need it. Thanks for watching.